welcome. We have the privilege of having Melanie with us, fitness and lifestyle coach. She has decided to share her breast dog experience with us, and she has almost 1 million followers almost on Instagram and other social media stuff. And so she's gotten a lot of questions from her fans and people who you coach and so forth about the process. So we thought rather than just doing our normal kind of consultation that we would talk about them, and that way she can share them, I can share them with you guys, because a lot of people have the same questions and sometimes you don't even know what questions to ask. And so I thought this would be good for everybody. So kick us off.
First question is, when can I get back in the gym again?
Of course, that's your first question.
Yes, for sure.
It's a little bit of a stepwise, and obviously depends on your procedure. But for a breast dog, I tell people, in general, most people can do this on a Wednesday or Thursday, be back to a typical type of like desk job on a Monday. In terms of like fitness, I let people get back into the routine at about a week, 2 weeks of like doing some really light stuff. I try to have people avoid any type of chest exercise for about a month, just because you really want the implants to set, you want the pockets to be perfect. You also don't want to get your heart rate overly up because you can put yourself at risk for bleeding on the inside. You're investing a lot of time and effort, so you really want to give yourself a time to heal. But I know for a lot of people, it's even as much a mental break as a physical break, getting back into the gym. So getting back in some light stuff at about 2 weeks is super reasonable.
So I've heard the different kinds of implants: saline, silicone, gummy bear. What's the difference between each, and what's best for me?
Yeah, and that's very key, like what's best for you, because what's best for each person really depends. No question, the silicone, the gel implants have become the most common in the United States now. Gummy bear is definitely a little bit of a confusing term, and I think people sometimes think it's a completely different type of implant, but really gummy bear stands for a highly cohesive gel. So basically that's just a different type of gel, and the benefit of the gummy implant is that the gel just sticks together more. So it got the nickname because if I was to cut this implant in half, hold it over, the gel would just stick here. The idea is that in people who are really thin, like yourself, you're less likely to see some of the rippling or edges of the implant, something that people hated about the old saline implants. The other benefit of the gel implants tends to be that they're just much softer. If somebody's looking for a little bit more natural feel to the implants, the gels tend to be more popular. The other really kind of cool thing about them is that I feel like people can go a little bit bigger and still not look overly round and fake. So you can really get kind of that nice full but still soft feel to your breast, which really makes these super attractive.
Thanks. I'm going for those. The different ways of inserting the implant: through the nipple, armpit, belly button. Is there a better way? And again, what's best for me?
Yeah, I think that's a great question. And so definitely the three most common ways in the United States are through the fold underneath the breast, around the areola, so right at the border where the areola and the skin match, or in the armpit in one of the natural creases. Which one's best really depends on a lot of factors. If people have a nice breast shape and they have a really well-formed fold, then the fold tends to hide really well. People who are very flat-chested or people who are prone to keloids, hypertrophic scars, then sometimes we'll do something else, like either through the armpit or at the border of the areola. So this is really one where you really want to talk to your plastic surgeon about your concerns. They'll look at your breast. And then you also want, most surgeons do at least a couple different approaches, but you want them doing something that they do comfortably all the time as well.
So I try to coach my clients to not compare their fitness journey to anyone else's, because it's so different and so unique to everyone. Would you say that the size of an implant kind of goes the same per person as far as like a sizing guide?
I think that's an absolutely great point. I think the number one, the surgery itself is a different journey for everybody. Everybody handles pain and the recovery a little bit different, but absolutely the implant size, I would say that's the number one thing that messes people up. Somebody will come in and say, oh, my best friend got 400s, I love them, and then the friend may be 6'1" and they're 4'11", and it's just not going to look the same. There's a lot of factors: your size, how much breast tissue you have, what type of implant you're looking for, and so forth like that. So I think a couple of things to really help get you the best implant is, one, spend some time with your surgeon just sizing. We do a little sizing kit so everybody can look in the mirror, because then you put them in, you look in the mirror and you say, hey, I like this or I don't. I also encourage my patients to bring in pictures of stuff they like or don't like. It just helps us be on the same page, because stuff like natural or full can mean a lot of things to a lot of different people. So no question, don't let the infamous friend mess you up.
Yep, totally. So one of my followers just asked, would you do a lift and implants at the same time or in 2 different sessions?
In most cases, we can definitely do a lift and implant at the same time. There's a few rare situations where we don't, but in the vast majority of people, we can do it all at the same time. But this is also too where a consultation is super important because one, most people don't know whether they need a lift or not, and so your surgeon can help guide you at the plus and minuses of each one because there's definitely a myth out there that if I get a big enough implant, then I don't need a lift. And sometimes people can mess themselves up, and now you got an implant that you don't like because it's too big, and your breasts still don't look like you wanted them because you didn't do the lift. So the answer to that question is yes, but two, make sure that, if you're not sure what you need, do some consultations. Make sure you come with someone that can help guide you and show you the plus and minuses of lift versus not lift and aug and lift and so forth.
Awesome. So after pregnancy, how will they look after?
I don't know. That's absolutely a great question, and we get it all the time in terms of, because some of our patients are definitely younger, some of them may or may not be thinking about kids, may know that, hey, in the future I want kids, but it's almost hard to know how your breasts are going to change after pregnancy. We've had people who have had one child and their breasts have fallen, other people that have had 4 kids and their breasts still look phenomenal. So I tell people, there's no time period where you have to change the implants anymore, but also too, if you get these in your 20s and 30s, it's unlikely that you're going to keep these for the next 70 years. So, the things that are going to be most likely to affect your breast are pregnancy, breastfeeding, and then weight change. If people have large weight swings, that can also affect. So those are the type of things that'll change, but it's always hard to predict how they're going to affect the breasts.